What is up, everyone? Steve here, your favorite physical therapist. What we're going to do today is go over a sequence of exercises to help somebody improve their balance following a total knee replacement. Ideally, this video will be for someone that is at least 4 weeks after a recent surgery. Technically, these exercises could also be for somebody just wanting to improve their balance who may not even have had a total knee replacement. But in general, this video is geared for knee recovery patients. One of the reasons why I say a sequence of exercises is that when I have found throughout my clinical practice is that having patients go through a series of exercises to improve their balance oftentimes yields better results than just giving somebody a single exercise or a single activity in isolation. So telling somebody, hey, just do a single leg balance exercise or work on modified a tandem stance exercise, doing that in isolation is a little bit difficult, whereas if you warm up to it, maybe by doing a little bit of stretching, some dynamic exercises, then you begin to actually work into the balance exercises. They are oftentimes more beneficial. So what I'm gonna do today is actually walk you through those exercises and you will see exactly what it looks like. So let's get started. So the first thing we're gonna do is start off with a static stretch style exercise. The way I like to have people do that, we're gonna utilize a door frame because it's a safe place for us to exercise and actually helps us keep our balance. So we're gonna pretend that we just had a surgery on my right leg here, on my right knee. One of the most important aspects of balance is ankle range of motion. Tight ankles are highly correlated with an increased fall risk. So anytime I want to improve someone's balance, one of the first things I'm always going to look at is ankle range of motion and ankle stiffness. I can almost guarantee you somebody that has poor balance very likely has very poor range of motion in their ankles. So a simple way to improve and to stretch those muscles in your calf is here in a door frame. Putting your heels up against the back of the door frame, keeping those heels planted to the ground, and just leaning into that stretch. We're gonna do about 30 seconds here of just a really good stretch. So again, we're simulating a surgery on our right side. What you could also do to improve the stretch here is actually step back with that right leg and work on getting that heel down. Same thing, if I'm very stiff in my calf or if I'm lacking any knee extension, this will be a really, really good stretch. So again, we're just doing about another 30 to 45 seconds here. I could also do this on the other side by simply turning around. Same thing, you see me stepping back. So this would be if the surgery was on my left leg. After you've performed about a minute or minute and a half of static stretching, what I like to have people do is now go into a little bit more of a dynamic stretch by actually trying to do a calf raise. So what we're gonna do here is about 3 sets of 15 to 20 repetitions. So here we are doing our calf raises. I'm gonna take a little rest if I need to. Like I said, we're just kind of breaking it up and do about 3 sets of 15. If you need to, you can kind of shake your legs out. What I wanna make sure I'm doing here with these calf raises is not letting my knees bend. Here, I'm actually coming up, really thinking about making yourself a little bit taller is a cue I like to tell my patients, tell my clients to say, think about really getting taller. And by leaning forward, it's effectively bringing your toes up towards your nose, maximizing that range of motion. We're here, we got this has been about 15 repetitions. We would take a break. We could shake our legs out if we need to. We'll go ahead, let's do one more trial. Again, about 15 repetitions, keeping those knees straight, making ourselves taller. You'll feel a good burn here in the back of those calf muscles. Good. Now that we're a little bit loosened up, we did the static stretching, we did the dynamic stretching. After we've done that, now is when I like to say, let's go ahead and do some actual balance exercises. First one that I like to have people do is a simple static, just a static stand in the door frame, trying to stand on one leg. Now again, I like to have the door frame in front of you because what you can actually do, you can put that foot back there if you need to. If I can't stand at all for a single second, let's say my right leg is my leg that's really challenged, I could put my left toes back there and just work on this position. Maybe I can raise it up a little bit, trying to balance on one leg. So again, we're going to do a single leg balance, 20 to 30 seconds at a time. We'll do about 4 to 5 trials. We're here, we're balancing. Ideally, you won't need to touch the back of that wall, and you can just hold your balance here using the door frame as necessary. If the left leg was the surgical leg, I could face this direction. Same thing, working on my single leg balance. So I'm holding this position, again, 20 to 30 seconds. And if I need to, I can find the wall behind me, and that can help. So here we are, just holding our balance. If somebody just wanted to improve their general balance, you could actually do this on both sides. Even if you didn't have a recent surgery, you could still feel free to go ahead and use this. Really love doing this in the door frame, guys. It's so safe, it's so simple. You begin to fall, you begin to lose your balance, you really have something to hold on to. One more time. We'll say this is the 4th trial. And hold our balance on this side. If you really wanted to make this difficult, you actually could close your eyes, and that would be a really high level balance exercise. Now we have performed a static stretch, a dynamic style stretch, a static balance exercise activity. Now what I finally like to conclude it with is a dynamic balance activity. A very simple one that I will like to have my clients choose is just a tandem or a modified tandem walk. So what you would do is find an area in your house where you can walk approximately 10 to 20 feet in a straight line. And all we're going to do here is just, this is the standard kind of the DUI test. Trying to put one foot right in front of the other, walking in a heel-toe stepping pattern. So you would go 10 to 15 feet down. This area here is my weightlifting platform, so it's not quite 10 or 15 feet, but you get the idea. You could do the heel-toe stepping pattern, or you could also do some heel walking. Just walking on your heels, doing the best you can. Again, 10 to 15 feet. You would do about 4 to 6 trials of these. So walking down, again, on your heels, straightening your legs as much as you can. You would go down and back, again, approximately 4 to 6 times. So you're gonna have the static stretch in the door frame, followed by a dynamic stretch in the door frame, static balance exercise in the door frame, and then eventually what we would do is bring you out in a hallway. You could do this at your kitchen counter. Ideally, you do this either in a hallway, maybe where there's some walls on either side of you in case you lose your balance, you can grab onto the wall, or in your kitchen where your kitchen counters are to the side of you. In general, if you've had a knee replacement, you've had a recent surgery on a leg, what I tend to do is try to always exercise so the kitchen counter is on your weak side. So if I had a right knee surgery, if I could, I would try to set it up so the counter or the wall is on my right side, because if my right leg gives out, I'm going to want something to hold on to. This is the general sequence that I like to have my clients go through if they are struggling with balance issues. I hope you found this beneficial. If you did, please like, please subscribe, leave us a comment. Any questions or concerns, be glad to answer them. Maybe we'll make a video about it. Also, check out the guide to a total knee replacement. It'll be in the notes. It will be in the description underneath this video. Thanks a lot. Have a good day.